Hello and welcome to the Hypnosis Side Hustle podcast. My name is Rick Paddock and I'm your host. And yes, this is a podcast all about creating a clinical hypnosis practice as a side hustle. It's about using the power of not only the process of hypnosis, but the power of your client's mind, your patient's mind, for creating change and doing it as a side hustle. And so if you're new to this thought, to this experience of hypnosis as a side hustle, as a practice, or even if you've been doing it for quite a while, you're going to love today's episode. Today's episode is about defining hypnosis. What actually is hypnosis? If you're new to it, I'm going to give you 4, 5, 6 different definitions. If you have been in hypnosis for a while, you'll recognize that if we had a room of 100 hypnotists, we'd get 95 different definitions because there isn't one standard definition. And so I'm going to throw out a few. I'm going to talk about and offer some from some of the experts in the field. I'm going to share mine, and hopefully you can have a better understanding of hypnosis as I have it, and as you may have it as a side hustle. And so let's jump into it. Let's talk about what actually is hypnosis. How do we define it? And if you're going to do this as a side hustle, you have to have a comfortable sense of what actually is hypnosis. How do I talk about it? So let me give you a few different definitions from some of the experts in the field. So Dave Ellman was a pioneer in the field. Probably the two most well-known names, Dave Ellman and Milton Erickson. So Dave Ellman's definition of hypnosis is the bypass of the critical faculty of the conscious mind and the establishment of acceptable selective thinking in the subconscious mind. So let's break that down. The bypass of the critical faculty of the conscious mind. And so without going too far down that rabbit hole, the more you dig into this field of hypnosis, the way our mind works, you'll see there's often this description of one powerful mind with two parts, a conscious, a subconscious, and somewhere in between, typically as Dave Ellman described, it's in that conscious level is this thing that we call the critical faculty, the critical function that is kind of the gateway to the subconscious, that part of our mind which allows or doesn't allow this selective thinking in. So Dave Ellman describes hypnosis as the bypass, kind of getting through that gateway of the critical faculty that's in the conscious mind and getting down to that place, to the creative, imaginative place where all of our habits are, the subconscious mind. So again, one definition, the bypass of that critical faculty of the conscious mind and the establishment of acceptable selective thinking in the subconscious mind. I like it. Makes sense. There are people that will say, well, it doesn't include this or that. So let's jump on to another definition. Friend, fellow podcaster Jason Linett describes hypnosis as this. Hypnosis is a natural process in which your mind is more receptive to positive suggestion, insight, and releasing negative feelings. It's your mind's ability to rapidly integrate new skills, strategies, and strengths. So a couple of key things from Jason, it's a natural process. Natural process in which your mind is more receptive to positive suggestion, insight, and releasing negative feelings. In that it's also your mind's ability to rapidly, key there, one of the keys to hypnosis as a side hustle, as a business for self-hypnosis is that we can do things quickly. Rapidly integrate new skills, strategies, and strengths. So what I like about Jason's definition is he doesn't leave that part out, that's one of the benefits of this thing, this process that we call hypnosis, is that we can quickly integrate new skills, strategies, and strengths. So I love that. Another definition from another mentor. And in this definition, this comes from Dr. Richard Nongard, a fellow podcaster, friend, mentor, as he describes a little bit of a, breaks down the difference between hypnosis and hypnotherapy. That hypnosis is not a therapeutic process, that hypnotherapy is the therapeutic process that's built upon a foundation of helping, of empathy, and of sincerely desiring to help people make change, to feel positive, and to accomplish their goals in life. Whereas hypnosis is a natural state of mind, a natural phenomenon, or a vehicle for providing hypnotherapy. Hypnotherapy is the process that utilizes hypnosis, that utilizes that hypnotic trance state. And so a hypnotist or the hypnosis practitioner, as someone who's doing it as a side hustle, is the person who's helping the other person experience that natural trance phenomenon, that naturally induced state of mind, to make positive changes, to Jason's point, to find new strengths, skills, and strategies. So there we're seeing kind of a combination of some. And now if we go to the American Psychological Association's definition back in 2014, they defined hypnosis and hypnotherapy in these ways. Hypnosis is a state of consciousness involving focused attention and reduced peripheral awareness, characterized by an enhanced capacity for response to suggestion. So again, similarities spoken a little bit different way. State of consciousness, this is hypnosis. State of consciousness involving focused attention and reduced peripheral awareness, characterized by an enhanced capacity for response to suggestion. So it's a state of mind that's more open to suggestion from the outside world, inside world. They don't define that. But they do define, again, this is the American Psychological Association, back in 2014, defined hypnotherapy as the use of hypnosis in the treatment of a medical or psychological order or concern. Again, this is the American Psychological Association, so they're going to have a little bit of a twist. A lot of us in the industry wouldn't look at what we do as treatment. But there it gives you a few different definitions. And now I want to share with you my definition, or how I talk about it. So how I frame it in my mind is with 3 S's. This helps me to remember and describe and define hypnosis. So the first S, we've heard this a little bit already, is that hypnosis is a state of mind. It's a natural state of mind. I like to say in many ways that hypnosis is simply a natural state of mind that we experience every day in so many different ways. Among the more typical, as you heard from some of the definitions, focused state of mind, enhanced peripheral awareness, I think was a phrase. So a natural state of mind, like those times where we are driving, and if you've been in the business for a while, these are some common examples, but people can relate to them. A driving trance, excuse me, where we will miss an exit because we are in an internal focus. We've kind of zoned out and we're driving and we miss the exit. It's like, gosh, darn it, I missed that exit. We've been in a hypnotic trance state of mind, a narrowing of our focus of attention to our inside world, to another thought or stream of thought, a stream of consciousness. Another everyday natural state of mind while driving would be where you get to that destination and don't remember the trip, especially if it's been one that you've done often. Just the other day, I looked in the mirror, this was coming up my street, and thought to myself, did I actually stop for that stop sign? I was somewhere else. So it's a natural state of mind, like when we're driving, like when we're reading a book or watching a movie where we're totally focused into the story, where we are involved in a hobby, playing an instrument, knitting, crocheting, gardening, where we're so focused that our attention is in the moment, on our thoughts, to the exclusion of our outside world. And as you think about these examples, or think about some for yourself, getting lost in Google land, you may recognize, yeah, we do this all the time, every day. So it's a natural state of mind. In fact, in many ways, I like to say that those things that our clients come to us for are a hypnotic state of mind. For instance, there's that hypnotic, focused state of mind that's telling them, I need a cigarette. I need a cigarette. They're so focused that they do it just like when we miss the exit without the awareness of lighting up, or biting their nails because a certain time, trigger, or association came up. They flipped into that trance state, that narrowing of their focus of attention, and started smoking, biting their nails, having a drink, having a soda. So the things that our clients, patients may come to us for are already hypnotic trances, hypnotic states of mind. In fact, in this industry, we'll often say what we do is often a trance dance. We're helping them get out of one hypnotic trance into another one, into a more productive and fulfilling one. So that's one definition. The first S is it's a state of mind. The second S is that it's a scientifically measurable state of mind. Most people will agree, and again, there are varying opinions on this, but there, first of all, we can measure 4 primary states of mind, scientifically measurable from the brain wave state. There's the beta, where we're at, awake, alert. The alpha, next level, a little bit focused, perhaps right before, right as you're drifting off to sleep, getting super zoned into a book or a movie. Even lower brainwave states, the theta level, and then the deepest are the delta. It's in those two, the alpha and theta. Again, not necessary, but that's typically where we go intentionally to get, if we will, past that critical factor, get into that subconscious part of mind, to have our suggestions stick, hold, to have what our clients tell us that they want, get deep into their subconscious to the point where they accept it. So the second S is a scientifically measurable state of mind, and in that alpha or theta level, a focused, relaxed, aware state of mind. The third S is that it's a skill that in many ways hypnosis is like so many things that we do. It's a skill that we can get better at, that we can improve at. And once we walk our clients through the process of narrowing their focus of attention, perhaps including relaxation, bringing them back up to that beta brainwave state, and then back down to the alpha or theta level, the more we do it, whether it's through fractionation, and that's another topic we can cover in another episode, simply in and out of hypnosis quickly, rapidly, or whether they do it on their own through self-hypnosis or through listening to audios. Hypnosis is, like so many things that we do, a skill that we can get better at. What are we getting better at? We're simply getting better at that focus, getting to that focused, alert, narrowing of your focus of attention, that alpha theta brainwave state of mind. So that's a definition that I like to give if I've got time on one of those areas. In many ways, it's 3 S's: state of mind, scientifically measurable. It's a skill, something we can get better at. All of those are helpful for you as a hypnosis practitioner, as you build this as a side hustle, to know in your heart and to remind those people you're working with, friends, family, clients, that unlike some myths out there that only some people can be hypnotized, simply not true. We all are every day. We all can do it. And in fact, it's like so many things we do: riding a bike, learning how to use a keyboard. The more we do it, the better we get at it. Tying our shoes, driving a car. It's a skill that anybody can get better at. And so there's one part of my definition. The other thing I like to say, and I'll often say this in client sessions, is as we, in the pre-talk, talk about what to expect. And I'll say, in a moment when we go in the other room, or when you relax a bit in this chair, hypnosis, for the way that we hold it in this session, has kind of 3 qualities or characteristics. There's focus, there's awareness, and there's relaxation. Of those 3, really relaxation is the least important, but we're going to use it because it helps us get to that focused, internally focused and internally aware state of mind. We are often in a hypnotic trance. In fact, I'll tell my clients, we'll be playing with some waking hypnosis processes where I'll teach you things to do, eyes open, in many ways, fully awake and alert, not relaxed, but there's a focus and an awareness on specific things. And that's hypnosis. So, in addition to the three S's, I like to say that those other three characters or characteristics or qualities um, are in hypnosis that we incorporate as a clinical hypnotic practitioner, as a side hustle or as a business. And that's relaxation, focus, and awareness. So we've covered a lot. Those are some general definitions, some more specific. I hope that helps you understand. I hope it helps you be able to explain hypnosis, that it's not really a magical, mystical place. It's a place, really a state of mind that we go in and out of all day long. And that often those things that we're struggling with, those things that we or our clients want to change, are in many ways a hypnotic state of mind, a narrowing of their focus of attention, an automatic trance-like response that's unproductive, that they've learned accidentally, that they've accepted on a subconscious level unintentionally, but wonderfully through the process of intentional hypnosis and hypnotherapy, we can guide them through the process of learning on a subconscious level a better way of thinking, living, feeling, acting, behaving.